Welcome to the Nevada Workplace Safety and COVID-19, presented by the State of Nevada Safety Consultation and Training Section, SCATS. The State of Nevada has built this presentation to provide you with important information about COVID-19 in the workplace. Check the NV Health Response website for updated information on the State of Nevada, our cities and local government press releases on COVID-19. When you need facts to base decisions on, the Nevada Health Response website is a great resource for definitive information. We have created a resources page on the SCATS website for a list of all the references throughout this presentation. These two documents can be found in the press release section along with many other useful documents and press releases related to COVID-19. To reference these press releases, please visit our resources page. Previously, we mentioned the Declaration of Emergency Directive 003. Part of Section 3 of this declaration is included here. Businesses that serve food must follow the guidance outlined in Section 3, including they must ensure that the customers receiving orders outside the establishment follow social distancing practices. Customers must maintain a minimum of 6 feet of separation from others. There are many ways to accomplish this, such as using lines created on the ground with tape or paint, or having a procedure to deliver the items directly to the customers in their cars. They must also adopt contactless payment systems. Systems that allow customers to pay over the internet, either through computers or smartphones, should be instituted. Direct contact should be your last option. In any food service operation, food workers must strictly abide by all applicable hygiene guidelines and follow the U.S. Centers for Disease Control and Prevention sanitation recommendations, including routinely disinfecting surfaces and at frequent intervals throughout the workday. Section 4 of the directive covers essential licensed businesses, including but not limited to healthcare providers, veterinary services, grocery stores, pharmacies, financial institutions, hardware stores, convenience stores, security services, and gas stations. Continued operation is encouraged, but the adoption of the following COVID-19 risk mitigation measures that reduce risk of community disease spread are required. Provide curbside pickup or delivery of goods whenever possible. Ensure that the customers picking up or accepting curbside delivery of goods maintain social distancing practices. No congregating is allowed, and customers must maintain a minimum of 6 feet of separation from others. Disallowing the formation of queues or lines and adopting contactless payment systems that allow customers to pay over the internet, either through computers or smartphones, should be instituted, and direct contact should be your last option. And if unable to provide takeout, drive-through services, curbside pickup, or delivery of goods, businesses must limit access to its premises so that customers can maintain a minimum of 6 feet of separation from others. If unable to provide takeout, drive-through services, curbside pickup, or delivery of goods, you must also implement sanitation and disinfection policies that comply with U.S. Centers for Disease Control and Prevention sanitation recommendations. In general, most people will ask, how am I going to follow these rules? Here are a few ideas of how to do so. These are not the only ways, just a few possible options. Use tape lines or boxes on the ground to help the public maintain a 6-foot spacing while in lines for entry to your business and in checkout lines. Use employees to help guide the public to use the lines or boxes and other procedures you put in place. Make sure your employees maintain their 6-foot separation. Use online payment systems through smartphones such as Apple Pay and similar Android products. At curbside pickup points, use procedures to allow the employee to place the product being picked up in a specific area and then retreat before the customer moves forward to retrieve the product. As an essential business addressed in Section 6, the construction, mining, manufacturing, and infrastructure sector labor force may continue operations, but shall maintain strict social distancing practices. Workers must maintain a minimum of 6 feet of separation from others and the general public. Any business operating under this authority must comply with any applicable COVID-19 risk mitigation policies as further defined in regulations communicated under this directive, and any other precautionary measures and guidance that shall be communicated by the Nevada Department of Business and Industry. Some examples of ways to comply with Section 6 of this directive are listed here. Shuttle buses used in specific industries should be configured in such a way that users are not capable of sitting within 6 feet of other riders. Ideas to consider: remove seats, place large boxes that are secured in place on seats, tape off seats, etc. All surfaces should be disinfected between each run of the shuttle. In equipment that does not allow for at least 6 feet of space between users, such as most boom lifts and scissor lifts, only one occupant may be allowed. These are once again only a few examples. For additional guidance to businesses in these sectors, please see Nevada OSHA's memorandum providing guidance for staff and labor in the mining, construction, and manufacturing industries at the link provided here. The following items are Nevada OSHA guidance. The references for these items are included after each item. Restrict meetings, safety meetings, tailgate talks, and gatherings to no more than 10 people. Establish effective social distancing protocols, which ensure that staff maintain a 6-foot personal separation from other staff during meetings, discussions, etc., where 10 people or less are present. Ensure that social distancing protocols are maintained during operation of mobile service equipment designed for 2 or more passengers, including, but not limited to, man lifts, scissor lifts, etc. Provide sanitation and cleaning supplies for addressing common surfaces in multiple user mobile equipment and multiple user tooling. Maintain 6-foot separation protocols for labor transportation services such as buses, vans, etc. Conduct daily surveys of changes to staff and labor health conditions. Ensure that any identified first responders in the labor force are provided and use the needed personal protective equipment, PPE, and equipment for protection from communicable or infectious disease, and provide access to potable and sanitary water. For more information and guidance on OSHA requirements, review OSHA 3990-03-2020, Guidance on Preparing Workplaces for COVID-19. You can download this publication on our resources page. This can be a helpful tool to inform the workforce. As of March 25, 2020, it is also available in Spanish, OSHA 3992-03-2020. These are steps all employers can take to reduce workers' risk of exposure to the COVID-19 virus. These include focusing on jobs classified as having low, medium, high, and very high exposure risk, and providing specific recommendations for employers and workers within specific risk categories. If one does not already exist, develop an infectious disease preparedness and response plan that can help guide protective actions against COVID-19. Stay abreast of guidance from federal, state, local, tribal, and/or territorial health agencies, and consider how to incorporate those recommendations and resources into workplace-specific plans. Plans should consider and address the levels of risk associated with various work sites and job tasks workers perform at those sites. Such considerations may include where, how, and what sources of COVID-19 might workers be exposed, including the general public, customers, and coworkers, and sick individuals or those at particularly high risk of infection, such as international travelers who have visited locations with widespread sustained or ongoing COVID-19 transmission, healthcare workers who have had unprotected exposures to people known to have or suspected of having COVID-19, non-occupational risk factors at home and in community settings, workers' individual risk factors such as older age, presence of chronic medical conditions, including immunocompromising conditions, pregnancy. Controls necessary to address those risks. Follow federal and state, local, tribal, and/or territorial recommendations regarding development of contingency plans for situations that may arise as a result of outbreaks, such as increased rates of worker absenteeism, the need for social distancing, staggered work shifts, downsizing operations, delivering services remotely, and other exposure-reducing measures, options for conducting essential operations with a reduced workforce, including cross-training workers across different jobs in order to continue operations, or deliver surge services, interrupted supply chains, or delayed deliveries. Plans should also consider and address the other steps that employers can take to reduce the risk of worker exposure to COVID-19 in their workplace. For most employers, protecting workers will depend on emphasizing and preparing to implement basic infection prevention measures. As appropriate, all employers should implement good hygiene and infection control practices, including promote frequent and thorough hand washing, including by providing workers, customers, and worksite visitors with a place to wash their hands. If soap and running water are not immediately available, Provide alcohol-based hand rubs containing at least 60% alcohol. Encourage workers to stay home if they are sick. Encourage respiratory etiquette, including covering coughs and sneezes. Provide customers and the public with tissues and trash receptacles. Employers should explore whether they can establish policies and practices such as flexible work sites, telecommuting and flexible work hours, or staggered shifts to increase the physical distance among employees and between employees and others if state and local health authorities recommend the use of social distancing strategies. Discourage workers from using other workers' phones, desks, offices, or other work tools and equipment when possible. Maintain regular housekeeping practices, including routine cleaning and disinfecting of surfaces, equipment, and other elements of the work environment. When choosing cleaning chemicals, employers should consult information on Environmental Protection Agency-approved disinfectant labels with claims against emerging viral pathogens. Products with EPA-approved emerging viral pathogens claims are expected to be effective against SARS-CoV-2 based on data for harder-to-kill viruses. Follow the manufacturer's instructions for use of all cleaning and disinfection products, such as concentration, application method, and contact time. A critical step in protecting workers, customers, visitors, and others at work sites is developing policies and procedures for prompt identification and isolation of sick people, if appropriate. Employers should inform and encourage employees to self-monitor for signs and symptoms of COVID-19 if they suspect possible exposure. Employers should develop policies and procedures for employees to report when they are sick or experiencing symptoms of COVID-19. Where appropriate, employers should develop policies and procedures for immediately isolating people who have signs and/or symptoms of COVID-19 and train workers to implement them. Move potentially infectious people to a location away from workers, customers, and other visitors. Although most worksites do not have specific isolation rooms, designated areas with closable doors may serve as isolation rooms until potentially sick people can be removed from the worksite. Take steps to limit spread of the respiratory secretions of a person who may have COVID-19. Provide a face mask if feasible and available, and ask the person to wear it if tolerated. Note: a face mask, also called a surgical mask, procedure mask, or other similar terms, on a patient or other sick person should not be confused with PPE for a worker. The mask acts to contain potentially infectious respiratory secretions at the source, such as the person's nose and mouth. If possible, isolate people suspected of having COVID-19 separately from those with confirmed cases of the virus to prevent further transmission, particularly in worksites where medical screening, triage, or healthcare activities occur, using either permanent barriers such as a wall or separate room, or temporary barriers such as plastic sheeting. Restrict the number of personnel entering isolation areas. Protect workers in close contact with a sick person or who have prolonged or repeated contact with such persons by using additional engineering and administrative controls, safe work practices, and PPE. Workers whose activities involve close, prolonged, or repeated contact with sick people are addressed further in later sections covering workplaces classified at medium and very high or high exposure risk. Develop, implement, and communicate about workplace flexibilities and protections. Actively encourage sick employees to stay home. Ensure that sick leave policies are flexible and consistent with public health guidance, and that employees are aware of these policies. Talk with companies that provide your business with contract or temporary employees about the importance of sick employees staying home and encourage them to develop non-punitive leave policies. Do not require a healthcare provider's note for employees who are sick with acute respiratory illness to validate their illness or to return to work, as healthcare provider offices and medical facilities may be extremely busy and not able to provide such documentation in a timely way. Maintain flexible policies that permit employees to stay home to care for a sick family member. Employers should be aware that more employees may need to stay at home to care for sick children or other sick family members than is usual. Recognize that workers with ill family members may need to stay home to care for them. See CDC's interim guidance for preventing the spread of COVID-19 in homes and residential communities. Be aware of workers' concerns about pay, leave, safety, health, and other issues that may arise during infectious disease outbreaks. Provide adequate, usable, and appropriate training, education, and informational material about business-essential job functions and worker health and safety, including proper hygiene practices and the use of any workplace controls, including PPE. Informed workers who feel safe at work are less likely to be unnecessarily absent. Work with insurance companies, such as those providing employee health benefits, and state and local health agencies to provide information to workers and customers about medical care during the COVID-19 outbreak. Occupational safety and health professionals use a framework called the hierarchy of controls to select ways of controlling workplace hazards. In other words, the best way to control a hazard is to systematically remove it from the workplace, rather than relying on workers to reduce their exposure. During a COVID-19 outbreak, when it may not be possible to eliminate the hazard, the most effective protection measures are engineering controls, administrative controls, safe work practices, a type of administrative control, and PPE. There are advantages and disadvantages to each type of control measure when considering the ease of implementation, effectiveness, and cost. In most cases, a combination of control measures will be necessary to protect workers from exposure to COVID-19. In addition to the types of workplace controls discussed below, CDC guidance for businesses provides employers and workers with recommended COVID-19 infection prevention strategies to implement in workplaces. View the full CDC guidelines on our resources page. Engineering controls involve isolating employees from work-related hazards. In workplaces where they are appropriate, these types of controls reduce exposure to hazards without relying on worker behavior and can be the most cost-effective solution to implement. Administrative controls require action by the worker or employer. Typically, administrative controls are changes in work policy or procedures to reduce or minimize exposure to a hazard. Safe work practices are types of administrative controls that include procedures for safe and proper work used to reduce the duration, frequency, or intensity of exposure to a hazard. While engineering and administrative controls are considered more effective in minimizing exposure to COVID-19, PPE may also be needed to prevent certain exposures. While correctly using PPE can help prevent some exposures, it should not take the place of other prevention strategies. Examples of PPE include gloves, goggles, face shields, face masks, and respiratory protection when appropriate. During an outbreak of an infectious disease such as COVID-19, recommendations for PPE specific to occupations or job tasks may change depending on geographic location, updated risk assessments for workers, and information on PPE effectiveness in preventing the spread of COVID-19. Employers should check the OSHA and CDC websites regularly for updates about recommended PPE. All types of PPE must be selected based upon the hazard to the worker, properly fitted and periodically refitted as applicable, for example, respirators, consistently and properly worn when required, regularly inspected, maintained, and replaced as necessary, properly removed, cleaned, and stored or disposed of as applicable to avoid contamination of self, others, or the environment. Employers are obligated to provide their workers with PPE needed to keep them safe while performing their jobs. The types of PPE required during a COVID-19 outbreak will be based on the risk of being infected with the virus while working and job tasks that may lead to exposure. Workers, including those who work within 6 feet of patients known to be or suspected of being infected with COVID-19, and those performing aerosol-generating procedures need to use respirators. National Institute for Occupational Safety and Health approved N95 filtering face piece respirators, or better, must be used in the context of a comprehensive written respiratory protection program that includes fit testing, training, and medical exams. See OSHA's Respiratory Protection Standard, 29 CFR 1910.134 on our resources page. When disposable N95 filtering face piece respirators are not available, consider using other respirators that provide greater protection and improve worker comfort. Other types of acceptable respirators include a RP95, NRP99, or NRP100 filtering face piece respirator, an air purifying elastomeric, meaning half face or full face respirator with appropriate filters or cartridges, powered air purifying respirator with high efficiency particulate arrestance filter, or supplied air respirator. See CDC NIOSH guidance for optimizing respirator supplies on our resources page. Considering using PAPRs or SARs, which are more protective than filtering face piece respirators for any work operations or procedures likely to generate aerosols, such as cough induction procedures, some dental procedures, invasive specimen collection, blowing out pipettes, shaking or vortexing tubes, filling a syringe, or centrifugation. Use a surgical N95 respirator when both respiratory protection and resistance to blood and bodily fluids is needed. Face shields may also be worn on top of a respirator to prevent bulk contamination of the respirator. Certain respirator designs with forward protrusion duckbill styles may be difficult to properly wear under a face shield. Ensure that the face shield does not prevent airflow through the respirator. Consider factors such as function, fit, ability to decontaminate, disposal, and cost. OSHA's Respiratory Protection e-tool provides basic information on respirators such as medical requirements, maintenance and care, fit testing, written respiratory protection programs, and voluntary use of respirators, which employers may also find beneficial in training workers. Find the link to the e-tool and respirator guidance on our resources page. Respirator training should address selection, use such as donning and doffing, proper disposal or disinfection, inspection for damage, maintenance, and the limitations of respiratory protection equipment. Learn more about respiratory protection at our resources page. The appropriate form of respirator will depend on the type of exposure and on the transmission pattern of COVID-19. See the NIOSH respirator selection logic or the OSHA respiratory protection e-tool on our resources page. Engineering controls for COVID-19 examples include installing high-efficiency air filters, increasing ventilation rates in the work environment, installing physical barriers such as clear plastic sneeze guards, installing a drive-through window for customer service, specialized negative pressure ventilation in some settings, such as for aerosol generating procedures such as airborne infection isolation rooms in healthcare settings and specialized autopsy suites in mortuary settings. Examples of administrative controls for COVID-19 include encouraging sick workers to stay at home, minimizing contact among workers, clients, and customers by replacing face-to-face meetings with virtual communications and implementing telework if feasible, establishing alternating days or extra shifts that reduce the total number of employees in a facility at a given time, allowing them to maintain distance from one another while maintaining a full on-site work week, discontinuing non-essential travel to locations with ongoing COVID-19 outbreaks. Regularly check CDC travel warning levels on the CDC's website. Developing emergency communications plans, including a forum for answering workers' concerns and internet-based communications if feasible. Providing workers with up-to-date education and training on COVID-19 risk factors and protective behaviors such as cough etiquette and care of PPE. Training workers who need to use protective clothing and equipment with how to put it on, use or wear it, and take it off correctly, including in the context of their current and potential duties. Training material should be easy to understand and available in the appropriate language and literacy level for all workers. Examples of safe work practices for COVID-19 include providing resources and a work environment that promotes personal hygiene. For example, provide tissues, no-touch trash cans, hand soap, alcohol-based hand rubs containing at least 60% alcohol, disinfectants, and disposable towels for workers to clean their work surfaces. Requiring regular hand washing or using of alcohol-based hand rubs. Workers should always wash hands when they are visibly soiled and after removing any PPE. Post hand washing signs in restrooms. Follow existing OSHA standards. Existing OSHA standards may apply to protecting workers from exposure to and infection with COVID-19. While there is no specific OSHA standard covering COVID-19 exposure, some OSHA requirements may apply to preventing occupational exposure to COVID-19. Among the most relevant are OSHA's Personal Protective Equipment Standards, which can be found in General Industry 29 CFR 1910 Subpart I, require using gloves, eye and face protection, and respiratory protection. Find the link to the OSHA regulations on our resources page. When respirators are necessary to protect workers or where employers require respirator use, employers must implement a comprehensive respiratory protection program in accordance with the Respiratory Protection Standard, 29 CFR 1910.134. See the full document on our resources page. The General Duty Clause, Section 5A1 of the Occupational Safety and Health OSH Act of 1970, 29 U.S.C. 654A1, which requires employers to furnish to each worker employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm. Read the full act on our resources page. OSHA's Bloodborne Pathogen Standard 29 CFR 1910.1030 applies to occupational exposure to human blood and other potentially infectious materials that typically do not include respiratory secretions that may transmit COVID-19. However, the provisions of the standard offer a framework that may help control some sources of the virus, including exposures to bodily fluids such as respiratory secretions not covered by the standard. See the regulations on our resources page. The OSHA COVID-19 webpage provides additional information about OSHA standards and requirements, including requirements in states that operate their own OSHA-approved state plans, record-keeping requirements and injury illness recording criteria, and applications of standards related to sanitation and communication of risks related to hazardous chemicals that may be in common sanitizers and sterilizers. See the OSHA standards on our resources page. In general, all PPE must be selected based upon the hazard to the worker, properly fitted and periodically refitted as applicable, consistently and properly worn when required, regularly inspected, maintained, and replaced as necessary, properly removed, cleaned, and stored or disposed of as applicable to avoid contamination of self, others, or the environment. COVID-19 fit testing guidance can be found on our resources page. OSHA's website is a great resource of information for workers and employers. The COVID-19 webpage includes information on many areas including hazard recognition, medical information, standards that apply, hierarchies of control, and many more. For the best updated information, check the websites listed regularly, or you can call the phone numbers listed also. Thank you for your attention.